Hi, I'm Rachel Anderson. I'm a physical therapist at Progressive Physical Therapy, and today we're just giving you some tips on strengthening through your lumbo-pelvic region. So these 3 exercises are meant to help anybody who has experienced instability of their hips, of their pelvis, or of their low back. The idea is to isolate. So we're trying to isolate what's called the posterior chain. So your lumbar paraspinals, your gluteals, and your hamstrings. These 3 exercises are meant to really help anybody recover from anything lumbar, spine, or pelvic related. So you're going to be on your single leg. So let's say this is the involved leg. You're moving into this position, so a relative balance position. And then slowly, at about a count of 3, you're coming up into this position final, and then right back down. So the most important, I should say, piece of this exercise is that transition. So when you are down here, feeling steady and stable enough in this limb to transition yourself up to here, and then right back down to this position without losing that control of that pelvis. Okay. You want to give it a try? Yeah. Yep, so you're standing on this leg here. Good. Bring your leg back long and strong. Okay, when you're ready, standing all the way up. Good. And then right back down with control. Yep, and be soft in your knees so that you don't lock your knee out. Good. The other piece of this that is paramount for control is making sure that your knee is traveling laterally towards your outside of your foot. You do not want your knee collapsing towards your big toe. Oh, you do not? No. Okay, so you're working on your standing leg ultimately. So this leg is the leg that you're gonna be moving on. So you're gonna move back in this direction. Same rules apply. You really don't wanna have that medial collapse. You wanna be keeping your knee in alignment either over your toes or to the pinky toe. You're going back as far as you can control. You have such little weight in your sliding leg that you should be able to ultimately lift your leg off of that slider when it's back. Okay. The second position, so you'll move from this position to this position, lateral. Same idea. Keep the alignment of the lower leg, external rotation. Keep your foot active. Same idea. When you're out to the side, you have such little weight that you're lifting your leg. So you'll come back, lift, come forward, lift, back to midline.
And every time stand up?
Every time stand, yeah. Good. Excellent correction. Next time you come lateral, I want you to try to lift your foot in that position. Yeah. Bring your leg out to the side. Good. Good. Hard, yeah. So basic deadlift is the last one, and this is gonna bring together both of those sides you've been working on for stability. So deadlift can get messed up easily. So the first thing I want you to think about here is range of motion of your hips, alignment of your spine, and then angle of your arms as they dangle. You wanna keep your arms really close to your knees. So this is the wrong position. This is the right position. Elbows really close to your knees. As you stand, you're looking up. You lift here, all the way thrust with your hips forward, and then hinging at the hips more than squatting till you come all the way to the floor.